Hi, I'm Dr. Markwada, and I'm hosting this chat on behalf of The Next Step. There are so many things as a graduate I wish I knew about that university just didn't prepare me for. And that's where the wonderful The Next Step comes in. I'm joined by fellow dentist Dr. James Foster and Dr. Tilly Houston, both currently working as associates, and Dr. Megan McLeod, who started her foundation training this year. Welcome, everyone. Life as a dentist is both mentally and physically demanding, and yet there are limited bespoke resources that not only help us prevent poor mental health, but equally as important, that help us flourish. And that's why I trained as a positive psychologist and founded my company, Mind Ninja, to help dental professionals feel happier, healthier, and thrive. So let's take a deep dive into wellbeing to help you transition this next step. So our wellbeing is such a crucial part of looking after our patients as well as just enjoying our dentistry. What are any wellbeing practices that you're kind of currently doing?
So mine aren't super strict, but there are a few things that I do that I found really help just to kind of keep my mind rested. One of the main things that I found is, because one of my practices, I work quite late into the evening, like 8 o'clock at night. Sometimes I was finding my brain couldn't shut off, and I would lie in bed and I'd just be thinking about teeth and patients, and I wasn't getting enough sleep. So I think being really strict with myself at not having my phone right before I go to bed and looking on Instagram, but also just doing something completely different, reading a book, listening to some music, watching a film, watching some TV, just something that I find just lets my mind rest has been really important. Another thing, and this sounds really silly and basic, but drinking water. I think during the day it can get so busy and you don't have time to just stop and drink some water. But I've literally, my nurse and I, we have this moment and we put it in the diary on the day list. We're like, stop, drink, like just stretch your legs, go to the bathroom, and it just breaks up the day, refresh, restart, so that you can kind of go to the next patient with like fresh eyes. That really helps me get through the day.
I completely agree, especially with the water part. It is very easy to get dehydrated because, especially if you've got a full day list and you're running a little bit behind, it's very easy to not think about it and just work. So just between patients, I always just try and have like a little sip from my water bottle and carry on. And in terms of something to help my mental health, the biggest thing I found is just really leaning on my support network. So if I've had a particularly challenging case or a patient that's been difficult, or it's just been a long day, just, talking with my nurse, other dentists at the practice, my girlfriend, my parents, people from my scheme, my old dental colleagues, just talking about it with them, getting out of the way, because that way I'm not lying in bed thinking about it all day and not being able to get to sleep.
Yeah, I definitely I agree with Tilly that I find it difficult to switch off sometimes, especially if you've had a difficult day or a difficult case. Living with someone else who does dentistry, it's hard if you've not seen them all day. You want to like chat about your day, but then you also want to switch off. So it's quite hard because sometimes I feel like you need that reassurance, like, that they would do the same thing as you, but then you also don't think about switching off. So it's quite a hard balance between getting that support, but then not constantly going on about dentistry. It can be tricky sometimes.
Definitely.
Yeah.
What practices then do you do when it comes to wellbeing? Because I know you love dancing and you do so many cool things.
I've joined like the local running club, which is quite nice because I feel like I never get outside because you're in the practice like 9 to 5. So that's a really nice way of getting outside and then meeting young people in the area. My gym's on the way back from work and I normally meet my fiance there, so it's like a good motivation. And we found a really nice class where it's kind of the same group of people each week. They'll like fist bump you at the end and they'll like come up to you, and it's almost like a team thing because you're going through the workout together. And I think that's a really nice way of, again, even meeting people outside of dentistry, because a lot of the time you are surrounded by, even like on the study days, it's nice to sort of meet other people and have that kind of social aspect, which is really important as well.
What you've said really resonates as well. The only thing I'd add is trying to introduce things at work, which is something I've been new to since being so heavily involved in wellbeing. But just little things like taking a deep breath whilst you're delivering a local anaesthetic or waiting for the alternate to set. You've got these little moments where you can hone into the breath, and just that simple anchoring to the breath can really help reduce cortisol levels, as well as encourage a whole wave of positive emotions. So like little things that we can fit in I love this idea of, the water breaks, just checking in before you bring a patient in, asking yourself, what's going on with me at the moment? How am I feeling? Do I need rest right now? I know when I first graduated, that was difficult to do because you felt under pressure to be on time. And as I've gone on in my career, I'm more happy to take a little break if I really need to.
I find as well, like, say you've got like a really anxious patient and you're doing like a difficult extraction. Quite often when I'm calming them down, I'm actually calming myself down as well. Like, I'm like, nice deep breath, and I'm like, and you're like actually subconsciously you are actually doing a bit of that throughout the day.
Yeah,
those kind of patients as well.
Yeah, it's so great. You notice this upward spiral of positive emotions. It's like a win-win, really.
Sometimes I do it even mid-procedure. So, for example, if I'm having a very difficult extraction, I'm like, all right, I'm just going to check the x-ray, turn around so I'm not facing the patient. I'm not looking at the x-ray. I'm just having a little think, all right, calm down. What am I going to do next? How am I going to get this tooth out?
Yeah.
And the patient's fine because they know they're not in pain and they think I'm checking the x-ray, studying it hard.
Yeah.
And I'm just taking a little moment.
It's like, I'm just going to give you a little break now. And then actually give
Rest your jaw.
Yeah.
Yeah, just fitting those in any way you can, I think, is really, really useful. Gratitude is the act of paying attention to the positives in your day. So what are your kind of top wins when it comes to dentistry, big or small?
I'd say the biggest one is when you get an anxious patient in, they come in, the first thing they tell you is they hate dentists. Then they go on to tell you a story about, a time they went to the dentist, had a really, really bad experience, and you're sitting there very empathetic. By the time you've had that conversation, you've done their course of treatment, and they leave, and then they tell the front desk, that was the best experience I've ever had at the dentist. I want to come back here, but I only want to see that particular dentist. That to me is the biggest win you can get.
Yeah, I love that.
Yeah, I completely agree with that as well. For me, one of the most rewarding things is when you have someone who is anxious and seeing them get that trust and confidence and overcome their fears. It's so rewarding. And it is really nice when you do get that positive feedback as well. Even when you don't realise how much effort you're actually making to have someone say back like, oh, you've made me feel really relaxed, or you've really helped me. And as you were saying, being happy with what you've done is really rewarding.
I think generally just being grateful for our job, our career, our profession. We're so lucky to be doing what we do. We get to help people every day. Getting people out of pain is such a skill that not many other humans have in their profession. And I think just remembering that we've spent all those years at dental school trying to get to this point, doing our interviews, hurdle after hurdle. Now we're here, just be so grateful that we can do what we want to do.
Yeah, it's just such a big mindset shift, isn't it? Like I think it's quite easy for our brains to really focus on the negatives and focus on what's not going well, especially when we're upskilling and we're learning new techniques or, crown falls off. So having this ability to pay attention to the goodness is really, really positive. One thing that I really enjoy doing with my practice is we play gratitude ping pong. So I don't know if you've heard of this concept. So it's basically going around the different team members and sharing our different gratitude points, but quickly, like we're playing ping pong. And it's just really fun. It's so nice to hear like other people's wins.
Yeah.
And it just cheers you up, and you realise actually, yeah, like you were saying, there's so much positive in dentistry. It's not all doom and gloom.
I'm going to try that.
So dentistry, as we all know, is full of challenges and stresses. Have you ever experienced any mental health challenges?
So I find I'm quite an empathetic person and quite sensitive. So I find if I've had a day of lots of anxious patients or even angry patients, I find that it does affect me quite a lot. I feel quite emotionally exhausted. So even like if somebody, say in the team, is upset and they're going on about it, quite often I feel like I'm more affected than they are after they've said it, because I feel like you take a lot of that. Well, I feel like I take a lot of that weight, and it does affect me a bit. So I find that challenging sometimes, almost not letting it affect you as much.
So working so closely with patients as a dental professional, we are more prone to experiencing things like burnout. It's really, really common. I'm sure a lot of us have experienced some signs and symptoms. When we're actually thinking about what burnout means, it's characterised by deep emotional exhaustion, having kind of cynical thoughts about work, and really feeling like you're not making a positive impact to patients, Have you ever experienced any of those signs and symptoms?
I've had a few kind of moments where I've, kind of woken up in the morning after a good 8 hours sleep, exhausted, thinking, oh my gosh, I've got to go to work now. And when you sort of lose that waking up and looking forward to going in, that's when I started to realise, okay, something is like not right. I need to just take some time out. It's so exhausting. I had a friend who was like, oh, I've got 3 meetings today. That's a lot. And I said, we have 15 meetings back to back with no break every day with people. And you give so much of your energy and your time, and you've got your nurse and you're managing all of that. It's a lot, and you do need to give your brain a little break. So I think just being aware of if you're feeling exhausted and tired and a little bit more emotional, then you probably are getting towards that point. Book some like regular kind of breaks. Even if it's kind of 1 day a month off work, just to kind of reset, catch some sleep, do all your life admin that you're probably super behind on, just gives you that kind of breath to just keep going with things and hopefully avoid burnout.
100%. It's like a profession-wide problem. I think the biggest probably contributor to it is everyone's ability just to turn off. Everyone I know goes home at the end of the day and they're still thinking about teeth. It's very, very hard, especially if you're living with another dentist, to go home and not talk about teeth. And I've been told off for it quite a few times before.
So have I. There's like Megan sits.
Yeah, exactly. We're trying to
not
tell
talk about teeth.
No. Being able to have that time either in the evenings or just at the weekend where you're not thinking about it at all, you're doing something else. So find something you can put your whole mind to that's quite hard, or something that's so repetitive you can turn your mind off from. It's very, very helpful, I found.
Yeah, I find as well, I feel like I do care so much about the dentistry, but sometimes it's easy to try and give 100% to every single patient. But then if you do that to everyone, you find yourself absolutely exhausted. So it's kind of doing enough so that you're still giving really good care, but then not burning yourself out in the process. Being aware of how it is impacting you and if you're doing a bit too much. And I think it's about preventing it. So recognising the signs for you and things you can do to slow down and sort of prevent it.
Have you come across any services that can help support you? So if you've got to the point of burnout, do you know what you do, or have you come across any colleagues that have experienced it? And
I think something that's helped me is within your book, there's a lot of ways sort of help me recognise the signs of burnout and then what to do if you do end up approaching burnout. I think that's really helped. And I think that's something that's important for dentists because a lot of people don't talk about it much, or even stress. Can see that a lot of dentists are stressed, but then I think it is important to share those techniques and signs so that people can recognise and work out what their management techniques are.
yeah, absolutely. I think it is really, really important to know those signs and symptoms. So I don't know if you've heard of the mental health charity Confidential. That's a really good one. So that's basically a 24-hour helpline that you can call. You can also go through NHS practitioner health support to get your 6 CBT sessions without going to your GP directly. Like you said, anything you can do to prevent it is useful. Imposter syndrome is a common set of negative thoughts, and I'm sure we've all experienced some of those signs and symptoms. And it's characterised by persistent self-doubt where we actually feel like we're going to be found out as a fraud. Have you ever experienced any of those symptoms yourself?
I find in foundation year, because when you graduate, you're quite young, and especially if you have like a young looking face like myself, I find that quite a few patients can have negative perceptions of you before you've even started. So I've had quite a few that have said like, oh, trust me to get the new one, or when have you graduated? And it's, having spoken to my peers, it seems like it's a really common thing. And it does make you feel a bit like, oh, they don't have that confidence already, and almost like, oh, I've only just graduated, like, will I be good enough for this? But I think it's important to realise almost everyone's going through that as well, and just sort of switching off to try and not let it affect you as much, just like, you know that you're good. So just having that confidence in yourself and trying not to let any negative perceptions affect you and your confidence.
I've had it go almost completely the other way as well, in that sometimes when they come in and they know you're quite young, they know you're quite new, there's almost a slightly lower expectation of you. Whereas when they come in and the first time you get called doctor is when it really hits me. And you're like, oh my God, they're coming to me and they think I know all the answers. I don't know all the answers. I barely know enough. That's when it really hit me that, I don't know enough to do this kind of thing. But it's just leaning on the people around you, particularly on your educational supervisor when you're in a foundation year, and the resources around you just to make sure you can get through that, particularly on your other people in your scheme as well, because they'll all have the same stories.
I think just also remembering the training that you've had. You've spent 5 years at uni, you've passed your exams, you've been assessed so rigorously to make sure that you're safe and that you can kind of qualify and go into practice. So knowing that and having that kind of reassurance just to help you think, actually, I can do this, helps just to get rid of those thoughts sometimes. But yeah, I think everyone has it, especially at the beginning of your career.
Yeah, I mean, that really resonates with me. But what I've also noticed throughout my career, so it's been 12 years in dentistry now, whenever I upskill and I do something different, those thoughts pop up again. So it's not something that you can completely get rid of. But with mindfulness and self-compassion, there's a big emphasis on just noticing those thoughts and labeling those thoughts, noticing that your pattern, oh, I'm having a thought that I'm not good enough. And rather than fusing with the story of those thoughts, just labeling those thoughts. And simply by doing that, we can provide a little bit of distance between our thoughts and ourselves. And with that in itself can be really, really powerful. So we can use techniques like that. It's not something that we necessarily want to hear, because we want to know that we're just going to get rid of imposter syndrome and it's going to be all good. But actually, I think mindfulness and self-compassion, even, other techniques from cognitive reframing can be really, really useful. So how you spend your time really impacts your well-being. Do you have any top tips when it comes to managing your time?
So I think for me, I found that I'm really bad at taking work home with me, especially if you can kind of access your notes from home, referrals, clin checks, all that kind of thing, writing treatment plan letters. I find at the end of my day at work, I'm like, oh, I'll just go home and I'll do it from home on the sofa, but it's not really letting your mind rest. I'm not great at it, if I'm honest, but I've kind of said, okay, I'm going to need 2 hours or 3 hours in the week. And I try on a Sunday before the week before to find where I've got those slots. I can say, okay, I've got that evening free. I can sit and do some then. So at least I have made time for myself. Otherwise, it's just easy for work to kind of creep into every lunch break, every evening that you have. So yeah, I think just being strict and saying, get what you can get done in these 2 hours and then stop has helped me, but it's work in progress.
I found with adulting in particular, particularly when you leave uni and you get into your FD year, because at uni you're not in all the time. You're in most days of the week, but you've still got days off, you've got afternoons off, you got the whole evenings free. It's very easy to self-care and have a good social life and still have time for yourself. One of the biggest challenges I found was just having free time, because you're working 5 days a week. And by the time you get home, if you've gone to the gym, you've eaten, showered, done all your chores and stuff, you don't have much time in the evening. So most of your social stuff gets pushed to the weekend. And then before you know it, you're fully booked for the next 2 months. And you're like, I don't really have a weekend to myself that I can just relax on, which is quite hard. So I've started blocking those off at least once a month, just having something for me.
Can definitely resonate with that, especially if you've got, that you've got a busy few weeks. I'll try and almost feel like, as you say, block off, right? This weekend is just for me to just chill and make sure that you don't overload yourself.
Positive well-being isn't a destination, it's a journey. Do you have any well-being goals that you are specifically working on at the minute?
So I think for me, it's important to make sure that I do squeeze in exercise throughout the week. It is challenging if you've had like a long day and you're tired. I think that's where these classes that I've been going to has been quite nice, because it's almost like you just turn up and they're like, right, this is what you're doing. So you don't almost need that self-motivation other than to just turn up. So I've been trying to stick to that throughout the week. And also I'd like to start getting outside more and get more fresh air. So start going for some more evening walks and with the running club as well. Because it's one of those things that is hard to do, but you do feel so much better after. So it's trying to make time for that.
Yeah, I'd echo that. I try and go to the gym every day after work. And some days it's very hard because you finish a long day and you're thinking, oh, it's so easy just to go home. It's fine. I had a long day. I still just try and make myself go, even if it's only for a little bit of time. And having some goals in the gym as well are quite nice to work towards. Something else you can put your mind off dentistry.
My goal is sleep. I think it's the one thing that if I'm tight for time, I will compromise on my sleep. I'll work till later or I'll get up earlier, and trying to be strict with myself to allow myself to have enough sleep and not compromise on that.
I feel like sleep is such a hard one to fit in and even know how to do well, but I've noticed that even little things like having a blackout curtain can be really helpful, and having this wind down routine. We were mentioning how it's difficult to switch off, but having that evening routine that kind of preps you for sleep and preps you to switching off. So that could be, just putting a candle on and meditating or reading, or just having this that you do every evening can be really like a good way to prompt yourself to get ready.
Do you have any tips for like switching off your brain? Because that is something that's really hard as a dentist to switch off at night.
I really honestly think that just dedicating a bit of time to journaling can be really helpful. There's so much science to support it, and it doesn't need to be 20 minutes of writing, and it can be bullet points of just literally putting down your thoughts. It could be your worries, because sometimes it's the anxieties about next day treatment or things we haven't done, and it just swims around in our head. So putting that on paper is a great way of switching off. And also just potentially understanding what's going on emotionally for you. You can make sense of it, and that can really help you figure out your next steps. Another good tip is making time for meditation or slowing down and being restful. It doesn't even need to be a 15-minute, 10-minute, 20-minute meditation. It could be 2 minutes of closing your eyes, anchoring to the breath, paying attention to the breath, noticing the mind wander and just gently nudging it back to the breath. That's it. That process is really good for your brain. Lots of neuroscience to support it as well. So if you find meditation difficult, then what you could do is even be involved in mindful activities. So for example, when you brush your teeth at night time, really hone into the 5 senses. What can you smell, taste, hear, all of those senses. That's a great way of being present. So you can practice mindfulness by just being present during normal activities. I think what you were saying, Megan, earlier about hobbies is just really, really beneficial here. So having something outside of dentistry where you can switch off. There's some really cool research around getting into flow states. So you might have heard athletes say, getting in the zone. They love getting into the zone. It's really good for their brain. It's really good for happiness as well. So if there are activities that bring you into flow states, like it could be playing a board game, it could be baking, it could be running, it could, maybe that's a gym for you and you notice you get into flow states. But just really thinking what brings more flow in my daily life is going to help you switch off, but also increase your life satisfaction and happiness. I've thoroughly enjoyed our chat. Thanks for joining me, Tilly, James, and Megan.